Welcome back to the Morning Blend. Well, even if you brush and floss your teeth every day, you can't ignore the risk of oral cancer.
No, one American dies of oral cancer almost every hour, and it claims more victims than cervical, skin, and testicular cancer. So here to talk about the importance of dental health and awareness of oral cancer is Dr. Roberto Monteagudo from WisconsinSmiles.
Morning.
Good to see you again.
Good, nice
Great
to see you guys too.
Yeah, this is an important topic for us to talk about. April is Oral Cancer Awareness Month, right?
Yeah,
what do we
correct.
need to know about it?
Well, one of the important things about oral cancer is, number one, there's about 8,000 new people that are diagnosed with oral cancer every single year. I mean, 36,000 or so. Of those 36,000, about 8,000 of them die every single year. If you do the math, that's about one American every single hour, every single day. And unfortunately, for the last 30 years, that number hasn't changed. So it's one of those cancers that we have to do we really have to do a better job in diagnosing.
Yeah.
When we talk about oral cancer, does this include everything? Mouth, jaw, throat?
Yes,
Okay.
yes, it does. And the thing with oral cancer is that when it is found in the early stages, the cure rate is about 80 to 90%. If it's found in the late stages, the survival rate after 5 years is only about 30. That's it.
And is that what's more common, that you're finding it in stage 3, stage 4 by the time it's detected?
Yeah, unfortunately it is. And so in dentistry, you have these really cool new pieces of technology. Last time I was here, we talked about some technology, and when we talked about the oral cancer screening device that I brought that day, we talked a little bit more about it. So that's why I thought that it would be a really good thing to talk about that today.
Absolutely.
Yeah. What the video that we have, it demonstrates something like what you have here on set.
Yes.
And it emits a really powerful, like, blue light, right?
Yeah, it's actually a combination of blue, green lights, very high intensity, as you can see on the video. What it does, when we're looking at the oral tissue with ambient light, in other words, light from the overhead lights, we could see what we could see. But the good thing about the valve scope is, as it emits this light, any tissue that's being, any cells that are changing, or we call it dysplastic tissue, what it does, it doesn't absorb light. So when we look inside of the mouth, the normal cells will absorb light, but as you see on the screen, right off to the right there, that area right there,
the dark spot?
Yeah, that dark spot is an area of concern.
Or on the roof of the mouth. Okay.
That's the roof of the mouth?
So, yeah, so when we're looking at as dentists, this is what we see on the left side. On the right side, with the valve scope, we're able now to see these changes in tissue.
Well, and this might be an obvious question because you're here, but who, if someone is going to find oral cancer, who is it usually?
Well, the important thing that we should know, number one, this is not a diagnostic tool, it's a screening tool.
Okay.
So what we want to do is that when we go into the oral cavity and we find these areas, it's important that we follow up with either a brush biopsy, and I brought a brush biopsy kit here.
That's what this little thing is
here?
here?
Yeah, very non-invasive, not painful. What we do with this, which is a little brush. And
looks like a little toilet bowl cleaner.
Yeah,
It does.
Doesn't it?
So what we do is just kind of scrape some of the cells, put it on a slide, send it off to a laboratory. They'll analyze them.
Okay.
Or what we could do is send them right off to the oral surgeon. And what the oral surgeon will do, they'll do a scalpel biopsy and check it out. So the only way to really diagnose oral cancer is by doing a biopsy.
What are the risk factors? What's causing the increase in oral cancer?
Well, we have the usual suspects, which is smoking, okay, chewing tobacco, also drinking, but most importantly, HPV, which is the human papillomavirus. And so the human papillomavirus is linked to cervical cancer. And the crazy thing is that about 25% of the new cases of oral cancer found every single year are people that don't have the usual suspects. So in other words, they don't smoke, they don't drink. Pretty much anybody who is sexually active is a candidate to get oral cancer.
Well, and it was kind of made popular, not popular, maybe a poor choice of words, but through Michael Douglas
just
with
recently,
his throat cancer, and saying that was, found to be the root cause was
Yes.
the HPV virus, which is an STI, is sexually transmitted infection. So when we talk about things like that, if you're going through and you're doing the screening, then this is something you can do right in your office for someone. Is this a routine procedure? Is this something you have to ask for and request?
Yes, actually, what we do, we screen every single patient with ambient light. Then we ask them if they want to go ahead and have the screening. There are some patients that really don't want to have it done. They don't want to know.
Are there downfalls? I mean, is this like a radio?
No, no, it's extremely safe.
Okay.
It's just a very high intensity light. So there are some patients that just say, no, I don't want to. But most patients do, and so.
Is it relatively affordable to
Yeah,
have
it's
that screening done?
20, 25 bucks.
No
That's
way.
It. That's it. Yeah, that's it.
That's wild.
Why
Yeah.
would people turn it down?
Yeah,
That's
Some
shocking.
people would rather not know.
Yeah,
just
some
like
people
you
are just
said.
like that. Yeah, just people just rather not know.
Yeah, that is amazing. And let's talk about your Dentistry from the Heart event. What do you want to say about this?
Now, this is a great event. This is our 3rd year. I think dentistry's done a really good job in giving back to the community, and the American Dental Association, the Wisconsin Dental Association have their events. The last 3 years, we're part of an organization called Dentistry from the Heart. And Dentistry from the Heart, there's about 200 dentists nationwide that give one day. And all we do is give free dentistry. So it is Saturday, April 11th from 8 a.m. to 4 p.m. We're going to treat the first 75 patients. You either get...
No matter what.
No matter what. You either get a cleaning, filling, or an extraction. We have other dental offices that are coming in. Tony Signal from Signal Dental is going to be there, and his staff, and some other dentists. So it's a great day to give back to the community.
And
we're really
registration starts at 7:30. Do you anticipate people will line up earlier than that?
Usually, actually, we had this huge line. We're going to have another huge line this year again. And so come dressed for the weather, and it's first come, first serve.
All right.
It's wonderful that you also have this comprehensive dental exam, x-rays, and an oral cancer screening for just $45. That's for the first 40 people watching right now the Morning Blend who mention the Morning Blend when they call Wisconsin Smiles. That's an incredible deal for $45 to get that exam, x-ray, and screening. So call them right now. The number is on your screen. It's 414-962 3676 982. I'm sorry, I just said that wrong, didn't I? Okay, here's the number again. It's 414-982 3676. Their office is in West Dallas. You have the address there on your screen. You can also go to WisconsinSmiles.com.
Great info.
Thanks
Thanks so much.
Thank you very much.
Thank you
Thanks
so
for being
much.
again.
Appreciate
Thanks.
it.